So it's the morning time, and I'm still thinking about the autism thing, which is, again, another reason why people think I'm autistic. And so, I just watched last night's rant, and then I'm thinking about the bits and pieces that I didn't get into because I have working memory issues. And, these are rants, so I'm not writing scripts. I'm just kind of talking naturally about what I've thought about. And scripts are helpful because they organize my very cluttered thoughts. Oh, okay. Echolalia stuff. That was another thing to go into. So I can look, I think, autistic because sometimes when I really like a quote or something that I saw, I can, mimic it and repeat it perfectly. And, also, if I just hear an accent, I tend to mimic it and do it well. But then if I don't hear one for a while, it's I kind of lose that capacity. And the thing is when we talk about things like echolalia, again, because psychology is looking at these symptoms and it's doing its best to try to describe things, and what we're kind of using as an umbrella term for autism is kind of like what we're doing with EDS. It's EDS at first, we're oh, well, it's a connective tissue disease related to collagen, and then they're well, we're considering this hypermobile thing part of it, and it's actually a huge amount of people who are given this diagnosis actually have other things going on with connective tissue or that impacts connective tissue, so we can no longer call EDS a collagen mutation. So because it's a syndrome. And so when we have all of these different kind of psychological terms that we're or boxes that we're trying to fit people into, this is where issues can come up, because it's the label can be used in a way that's liberating, but then of course with stigmatization, it's also, it can be oppressive. But it's this is the thing where I get really, really frustrated with people. Because labels should only be used to liberate. So it's if I understand that a person is has autism, that if they've been they've experienced they've surpassed their threshold for sensory stimuli or negative sensory stimuli. And by negative sensory stimuli, what I mean by that is when the type of sensory stimuli that they find overwhelming has overwhelmed them. It's, it causes a meltdown, right? I understand that. And where was I going with that? Yes, they get this meltdown. And so when we have these labels, it's when we're understanding, oh, somebody, they have autism and that has sensory processing issues attached to it, then these ideas that oh, they're burned out now, they need recovery time. It's not oh, they're isolating, this is dangerous, we need to keep them company, because no, that's again overwhelming to them. Or, oh, they're isolating, and then this idea that they isolate, and then that's that is part of the trauma rather than the recovery is it's part of the myth that perpetuates the trauma and then creates the stigmatization. Well, if I actually need to do what I need to do to take care of myself, then I'm not I have to accept this stigmatizing label, which is what happens if we kind of ignore the label of autism. And the label of, if you're taking that on, it should be so that other people can kind of, look through the experiences of people who identify with the label, and to be able to kind of, use that to better understand their friends' experiences. So that's like the benefit to the label, and like for me, how labels should be used. Um, so I meet a lot of the criteria for autism. But then those labels sometimes can be really confusing because we base them off of like these clusters of things. So one of the examples that I used is okay, here, let's take an example. When we talk about leaves turning color, I used this recently in talking about Ehlers-Danlos syndrome and connective tissue diseases and doctors and stuff like that, but I think the metaphor can be applied in slightly different ways amongst a variety of circumstances. And I think that this is a helpful way. I like to look at trees and think about trees a lot. This is also like one of those kind of autistic things, I guess, of like having very specific, really niche interests and then going down rabbit holes with them. So when I think about a tree and leaves turning color, so leaves can sometimes turn color when it's not the fall. So an example of that is like if a tree gets infected by a disease of some sort, you can see the leaves turning color, and when they're not supposed to, and that's really because they're sick. So if you were to take a picture of that, and everywhere around you there were red maples, that tree might look like it's just a tree turning color in the fall. And it would be really hard to distinguish that from any other tree that has leaves that are turning color. But if you were to take a picture of that amongst other healthy trees nearby, or like with like green leaves and whatever leaves like are the colors that they're supposed to be, but let's say that none of them have naturally yellow or red leaves, it's going to kind of indicate to you that something is off. And regardless of it, it's like that tree maybe needs help. It's got something going on and its nervous system is overwhelmed. I'm calling it a nervous system. Maybe it's called something else. I don't know. I'm calling it a nervous system right now because I see, I don't know. I see a lot of, I personify trees. Let's just say that. So its nervous system is overwhelmed and it needs to heal. That can be missed or misinterpreted based off of everything else that's around it. And so sometimes when we're looking at traumatized individuals or people who have experienced a lot of different things, it's like one thing can look like another thing based on the circumstances that surround it. And it's really hard to tell apart, even for really, really trained people. And when we don't yet have the tools to understand it, or we're doing our best to describe something based solely on what we can perceive, and our perceptions are tainted by biases. So that's where I think it gets really difficult to tease these apart. But at the end of the day, it's like if you're a tree with leaves that are turning color, and you can relate to other trees that sometimes have certain experiences of being a tree with not typical leaves, let's put it that way, that commonality can still exist. You can find kindredship, or camaraderie. I don't know, I made up a word. Camaraderie. You can find camaraderie. Do not ask me to spell that word. That I still can't do it. By having that sort of like shared lived experiences. And I think that sometimes the process of taking an aspect of yourself and expanding it to include others. And we're living in a really interesting time right now because people who have experienced marginalizations are now getting platforms to kind of talk about their experiences and to talk about the way society has benefited certain individuals over others. And I feel that a lot. I really do. Yeah, I'm thinking a lot about it right now. and feeling a lot. But that's another video, because then this is coming, like some of my other intersectionalities are coming up. Sorry, the computer light went down. Oh, so when it comes to like echolalia, I definitely have more tendencies in alignment with echolalia than other people. Like if I play guitar, my guitarlele, I need a smaller bodied guitar. It really hurt my fingers, even on the classical guitar, to try to play it. It was really hard on my wrist and my neck. And if I'm lying in bed, it's a bit easier, but it's still challenging. So with echolalia, when I hear things, I tend to pick it up more than other people do, and that's related to a form of empathy. And so it's interesting, because I do think a lot of people with autism do have empathy when they're not, like really high levels of empathy, when they're not being, and this is the thing, because it still exists when they're being sensorily overwhelmed. But when we're sensorily, and this is where the we comes in, because I also have sensory sensitivities, when we're sensorily overwhelmed, we just, like, everybody else has to expand their empathy for a second. It's not our job at that point, because we are still picking up on the circumstances. And this is the thing, because I don't know if we've had this conversation within the non-neurotypical community. And then it's like, so I know the word autistic is being used a lot, and like then this is the thing that comes up, because it's like, I don't know how I feel about the word autistic, and I'm like, it's not, like, I don't know. I kind of like not neurotypical, because I don't think excuse me, I burped. I don't think I'm neurotypical. I'm really not. And I can't mask. I really don't. I can't do it. And I did mask for a long time, and this goes back to my experiences of, like, whatever, it's just a tangent video again, because I kind of, and this is where I get overwhelmed internally, and this is a trauma thing, not necessarily based off of the stimuli around me. As you can see, I'm keeping it dark in here. I don't even remember what I was about to say. Right, internally overwhelmed, emotionally, right. So a lot of people are looking at me like they don't believe me, so maybe they knew me growing up, and they were like, oh, she's not non-binary, or she's not. All of these things that she says she's just making that up for attention. And I, honestly, if those are your true feelings about me, then I don't want you in my life. I don't. For those of you who don't know, my mom was really sick growing up, and it made her really happy when I wore dresses. In fact, I didn't actually really like shopping, and I didn't I found shopping centers really overwhelming as a kid. I still find vacuums really overwhelming. I fucking hate vacuums. And yeah, I do. I'm okay in sometimes busy circumstances with my headphones on if I'm listening to songs I like on repeat. That's kind of how I survive a lot. And in my head, sometimes I'll sing songs in my head all the time, and that helps me. I focus on things visually in environments like trees, and miss other sensory stimuli that would be overwhelming or upsetting to me by looking at things that I like to look at. Also, these are kind of sensory processing resilient factors and stressors, and so I'm focusing on the things that cause me resilience, and using that to mask or to be able to survive in a neurotypical world. But if you take away all of those things that make me resilient, I'm gonna look like as autistic as someone else who maybe doesn't experience that as a positive stimuli. So it's like that's maybe a really good thing for me. Like, and like maybe that's where one of my privileges exists within being non-neurotypical, is that like there are still some things in my environment, and I also seek out environments that have these things in it. Like, I got really, really sad when I moved to Montreal because except in my neighborhood, and a lot of the neighborhoods there, all the trees are in boxes, which like they were just smaller because they were in boxes, and then they were in boxes, so that meant that there were lots of square shapes, and they had my trees in them. And I didn't like that at all. Oh my god, I really didn't like that. I don't like square shapes. Like, this is very autistic as well. I really like the circle is the best shape. In my opinion, for me, I love a good circle. I also okay, so like I was thinking about the triangles, and then I was thinking about my childhood best friend, because she showed me how triangles can be used effectively in art when we were like 5. So like you can draw a circle shape, and then rather than making the legs just come out of the circle, it's like if you put the triangle here to like signify like a dress, and then you put the legs down, you got like the skinny neck, and then like the triangle shaped body. And like for me, I know it's confusing because if I let my hair out, it's like the triangle is actually like my head shape. But we were kids, and our concepts were not fully developed, and that was a good extraction. But it was interesting to learn how, when triangles are not used in to create social hierarchies of oppression, that they can be very beneficial in art. So I don't hate the triangle shape. I'm not a fan of the square. Triangles, yeah, it's okay. Again, that's very autistic. Like, to have that level of like visceral response to almost panicking. Other things, like, people are like, oh, I see autism in that. And this is the thing. It's like, I could maybe by some people get an autistic diagnosis, or maybe some people who do get an autism diagnosis have these same experiences, and then also don't experience it universally, but because, like, it's like when they were like, oh, well, she's BPD'd because, like, she's staring down these people who abused her. Or when they were like, she's BPD because she's having delusions about being stalked, where it's like, actually, clearly I am being stalked and followed and stuff like that. And so it's not a delusion. It's actually happening. And I was like really on point and perceptive. And so what they try to say with BPD is, and I think with BPD, there's truth to that. I also acknowledge that BPD is based in trauma, where it's like you actually haven't had the resources. A lot of the time, there's been intergenerational trauma sometimes, and it's why I think it should be a trauma-based disorder, not a personality disorder, because your mood and everything is impacted, and you haven't had the resources and the environment to help practice other skills and to integrate and to heal that trauma. You're expected to be able to get on in this society that still denies the traumas that you have experienced intergenerationally and currently. And so I think that that's problematic. But then it can also be really hard when it's like I've had a lot of friends, and this is the thing where it's like sometimes I get frustrated with my autistic friends making social decisions, even though I still prefer hanging around autistic people with autism, or autistic people, whatever you prefer for you. That's fine. That is how I will address you. For me, I don't mind putting my label first because it's invisible and people forget it all the time. So, yeah. I prefer, even though I get frustrated, still being around my autistic friends. because there's more that I relate to. And it's the same thing with people with marginalizations. I relate to them more because I experience things that are similar and not to the same extent. Like, one of the things that I'm learning is, like, with the amount of people who are willing to step up and help in the situation that I'm dealing with now, clearly I have access to white privilege. And, like, again, I'm going to bring up an example. This is, again, more rants. Amanda Marshall, blue eyes, white skin, textured hair that is very blonde. And her mom is black from Trinidad. And her dad is white, and so she looks the way that she looks. And she still has the same history and the same genetic and ethnic and cultural background as her mother and her father. And then she has her appearance, so she benefits from appearing a certain way, but she still has this history. And so, like, one of the things I experience, and it's like, I don't want to make this what we talk about when we're still unpacking what happens to, like, black people in America and in Canada and the indigenous cultures here. And then also, but, like, I can also understand my experience and then use that to help validate and liberate. And maybe one day be able to talk about these sort of under the radar intersectionalities that aren't being noticed. And then also, again, the shame culture, that if you have these invisible identities, the idea that they have to be erased, the erasure. Erasure is traumatic. When you erase people and you erase that identity, it is traumatic. It is traumatic. Again, okay, we're about to come to 2222. It's 2222, okay. When you are, like, for me, and it's like, these are things that I still don't fully understand, and then people are like, oh, she's making it up, she's being dramatic, she's guessing, she's a hypochondriac, and I'm like, no, I'm doing all the best freaking research I can, and I can recognize certain symptoms, and, like, make, like I can unpack things. And again, I'm doing this looking at nosologies that are based on people who don't live the experience, trying to describe somebody's lived experience of having it. So there's something that will naturally be lost in translation. And so I'm looking at that and then trying to see how I relate to these different things. And there are certain things where it's like, if I look at, like, the EDS map and all the different symptoms, I can trace them back and be like, I have neurofatigue. 100% I have neurofatigue. And I get migraines, and I get this and that. And so all of that has to do with cerebral fluid leakages and, like issues with how it flows. And I can recognize that the things that can sometimes help with that or make it worse are also things that impact me. So I can say, okay, based on these lived experiences, this is probably what's going on for me. Same thing with fibromyalgia. So when people are like, what do you have going on with you? I don't want to explain things. We're still trying to understand what fibromyalgia is. So 100%, the first thing I recognize is that I definitely have myofascial pain syndrome, which is like when you have referential pain from different trigger points around your body that shoot and translate to other spaces. So it's like I get something going on in my neck and I feel things in my gut, and it's like, oh, if I push this thing here, this thing in my gut goes away. But this is a lot like acupressure, because it's like when we look at acupressure in Chinese medicine and pressure points, it's like that's often what helps. And we call it trigger point therapy in Western terminology sometimes. But it also does help with fibromyalgia. And so, like, with fibromyalgia, it's like we're looking at like all of these symptoms, and it can come from a variety of different things. And like 30% of people with, I think I read like 30% of like people with EDS also like meet the criteria for fibromyalgia. And then it's like, I do get fibro flares where it's like, I do have tender points where it's like, if you push them, and it's like, sometimes those tender points get better, but not without significantly adjusting my lifestyle, and that cannot always be maintained. And the same thing that they say with fibromyalgia is that you have flares and then other times it gets better. It's just, for me, I have a lot of other things going on, and then fibromyalgia seems to be a part of that. And again, a part of this, it's people who who do not have these conditions. Some of them, I guess, do, if they're able to have enough protective factors in order to get into a position of power, to be able to like have authority in those fields. It's like, so when you have this thing going on, sorry, I have a piece of espresso bean in my throat. So when you have these things going on, and you're like trying to explain them to a professional, it's like the professional, they're going to work with the concept that they have and they know. And it's like not necessarily a misdiagnosis when we create this kind of umbrella term. It's like, it's some of them, you can have different root causes. And it's really stigmatizing to feel like you're a liar because a professional isn't handing the label out to you, because professionals are incredibly biased. A lot of people who do have chronic pain will get misdiagnosed, particularly like women, small women, and people of color, and especially women of color, will get diagnosed with a whole bunch of different things with their mental health. Like, in terms of like making up their illnesses, lying about it. So like, let's just look at this for 1 second. This is where my neck turns to in the morning, and like I kind of have to lower my shoulder, and it's really stiff. And then it's like, let me just like do some pressure point stuff here, because I've got some crunchies. And so when I do my pressure point stuff, and I do like a little bit of myofascial release, I can turn it further. And so it's like, if I'm going to go out to an appointment where I have to work with somebody where I'm going to be sensorily overwhelmed, I try to do those sorts of things before I go in, or in the waiting room, so that I don't cause a flare. And then because I'm not having a flare, because I've done something to help manage, people don't want to give me the illness. But then they're very happy to throw things at me when I do get overwhelmed, because it's like I can't constantly do the practices where I'm doing all of these things and then everybody's denying my experiences. Where then they're very happy to give me a mental health diagnosis, where it's like nobody's actually been willing to look at what's been going on with my physical health accurately. And then there's also the incredible stigmatization of learning how to take care of yourself so that you don't just have really fucked up shit happen. And then there's like for example, it's like I was scared and might still be scared, but then I'm a little bit relieved based on some of the blood test results I got regarding my immune system, but not everything has been looked at entirely, so I still don't know. So it's like I have constantly high IgM levels, and that's not normal. But then it's like, one doctor was like, well, healthy normal people can be in this range, but I'm like, but I have low IgG levels as well. And they're like, yeah, but healthy normal people can have that too. You just, like, these are something you might see if you just have a cold. And then I'm like looking up the symptoms, though, of like somebody who is actually immunodeficient with high levels of inflammation, and they're like, you will constantly have a cold and stuff like that. And then they're like, but you're not sick, because if you had a cold, you'd have postnasal drip. And then I'm like, well, then how is it that I don't have a cold and I do have a cold at the same time? And they're like, it's like they're not making sense of it, because it's like clearly like the results that are coming up are suggesting a certain thing. And it's just the way I'm presenting doesn't meet their stereotype, because over the years I've learned how to manage these things, and it's like I'm not necessarily managing it through the ways that people, like a lot of Western culture, will manage health. And it's not that I'm opposed to Western culture, because I do use a lot of practices where it's helpful. Managing my ADHD, honestly, using stimulants has been beneficial. So is CBD. Like, there's, like, yeah, I like, but CBD is not like a Western thing. Though the isolated CBD form, probably came from a lot of scientists learning how to isolate these different plant parts. And I don't know. It's like, if you want to learn from different cultures, and then it's like you accept that, like, there isn't one culture that is better than another. It's just different cultures have different things that are beneficial, and can help or cannot help. Then all of a sudden you're a whole bunch of stigmatizing words. So that's been like a lot of my experiences in dealing with the medical community, and this was supposed to be about autism. Tangent brain. So it's about like dealing with, this is not just about autism, it's about dealing with why it's difficult to make a diagnosis of autism, because we have these stereotypes, and if you don't meet them, and the stereotypes are used also to create the label. Oh, look, do you see the hypermobility in my hands? Yeah. Sorry. Okay, so it doesn't, if I bend my entire hand, it doesn't go back that far. But that's, okay. Straight. Sorry, distracted. That looks like it's 90 degrees, doesn't it? This side, definitely. Yeah, I think I got a 7. The only one I can't do is like this one. So this is another thing. Let's go to EDS criteria and where I get pissed off. Ooh, I'm just ranting. So tricks when you're kids. And so like a lot of like the party tricks are like, did you do like cool hypermobility things? I'm like, no. A lot of my friends were like serious dancers, and I was like, I really wanted to do gymnastics, and my parents didn't let me and stuff like that. And like horseback riding and stuff like that, they didn't let me because they felt that I was very fragile. So I never actually like presented with what I thought was cool hypermobility. When I started doing yoga, it was very clear right away that I was hypermobile. Because I had no issues getting into like the crazy poses. I was just like totally out of alignment because I could just throw so many joints out. But that wasn't until like I was a teenager. But I did a lot of the tongue curling stuff. And so like those are things. I can't do it the other way. But then I'm like, is it like what's it called? Elastin. Because sometimes people with elastin have more flexibility on one side of their body than the other one. And it's like, I have that, but then that can also be due to a traumatic brain injury where there's like one side of my body has like I always use the left side of my body to brace myself. Often I use it to brace myself, and then I use the right side to do more actions, and I find it really hard to kind of switch that, but I can, like, my writing with my left side and my right side are pretty equal, but I find it easier to write backwards using my left hand, so starting from the right corner and going to the left. Yeah. So when it comes to like the criteria where doctors are like, oh, did you have these hypermobility party tricks? I'm like, my party trick was like what I could do with my tongue when I was like a kid, and we'd be there like doing all like the clovers and like can you do this one? Can you do that one? And that was my party trick. I had like my cousin could do like, I can't do it, but like could like just bend like the upper finger and stuff. But like I also didn't show off what I could do with my toes. Because like, you know, my dad and I would like pick stuff up with our toes all the time and like practice trying to write with our toes, and sometimes like I would try, like I practiced typing with my toes. And yeah, like that sort of thing. I guess those are party tricks, but like I was also an introvert, so I didn't like to go to lots of parties and show things off. So there's so many biases to that, and it's like if you're not like, it's really hard to identify yourself, because like the tongue hypermobility thing is totally like one of those kind of EDS things. So if you've got a lot of like joint hypermobility and you're not like, you're like 5, I guess, on the scale. Like this is another thing. So I don't know, my elbows, there were some people with like hypermobile EDS that were like not, yeah, like they were like, is that too much? And I'm like, so part of it is that I have so much loose skin that it's hard to see. And then people were like, well, you did like lose weight. And I was like, I was like overweight. Oh no, I was over. I don't like talking about weight. But when I was a kid, the doctors like to tell me that I was in the 98th percentile of weight, and obesity, and that I really needed to lose weight. So like when I was like 6, and I talk about this in a different video, and why I don't like talking about my weight, because how that's kind of used and then used to stigmatize and validate certain things that I don't want to, that I don't personally agree with. So when I was heavy, I was in the 98th percentile for my age group. I was like 98 pounds when I was in grade 4, and like, I guess like, I don't know, like 4'7" or something. And so just to make that clear, right now, I'm probably around like my weight fluctuates from like 102 pounds to like 100, and like I guess I get my heaviest these days like 112 pounds, so not much more than I was in the 4th grade. And then I'm only like 5 inches taller. So like I probably had like I was probably, I don't know, I was, however much skin that I developed in excess when I was in the 4th grade, I've probably, like, I've grown out of it. Like, I've grown. And so it's like, I wasn't so, like, even though they considered that to be huge, the doctors, it's not enough to validate the level of skin. Like, my neck is very skinny, and I can still do, like, there's still a level of hyperextensibility to my skin. So, yeah. And then there's just other things like not being able to close my eyes properly, the blue in my sclera. Hold on, can you see it? If I get, it's really hard in this lighting. There's like a blue rim around my brown eyes. which is related to connective tissue diseases. I was told, like, when I got my eyes examined because I was having vision issues, that a big part of it is that my eyes, they're deteriorating because they don't have a layer of something that produces these lipids that most people have, which is like, it's the connective tissue. You can also see it in my ears as well. I have eczema on like the cartilage and stuff like that. It's a connective tissue thing because it's degrading. This is supposed to be about autism. So, like, regardless of all of this stuff, it's like, and this was about party tricks. There were these party tricks. And the criteria is stupid because whether or not you go to parties is a huge part of it. Like, if you're bullied because you're different, if a lot of kids with autism, take it this way, if like a lot of people with autism also have EDS, and you were bullied as a kid, maybe you didn't get invited to parties. That is an exact example of marginalization. When you make the criteria for a disease where a person is experiencing incredible pain and suffering, and then you're like, well, you don't meet the criteria because you didn't go to parties when you were a kid. And then the joints that they're testing, it's like, that's not where your hypermobility is. And so, like, for me, the TMJ has been there my whole life. Sorry, I actually shouldn't do that. I went like 8 years with my jaw dislocated slightly and didn't know. And I had tinnitus. I developed pulsatile tinnitus in this ear because of it. And then when I popped it back into place, it went away. And so, yeah, I had done something to slightly dislocate my jaw, and I didn't even notice. So, what if you dislocate your jaw a lot and that sort of thing? And it's like, you know, you can't touch your thumb to your forearm, and, you know, maybe rather than like this, it's like maybe a doctor would look at this and be like, oh, I'm sorry, that's 87 degrees and not 90 degrees. Maybe. I'm not sitting there with the goddamn apparatus to measure. Or my knees, for example. I do squats every single, like because my knee issues are so bad. Like right now they're acting up because of the season. And in Montreal, and when I lived in colder climates, it was really, really bad. Like debilitating. Like, it would impact my mood bad. Yeah. Sorry, I was just thinking about that. Sorry, again upset. So I did squats every single day. And really, really worked on developing leg strength. And so if I have a day where the issues in my knees are so bad, I don't do anything. And then I were to go and do the Baton scale, I probably would not meet the criteria. Or I'd be like, I would get, because I'm 5. But let's say the pinky finger thing, they're like, oh, that's 87 degrees. I might not, depending on the doctor. Even with all the other symptoms I have going on. Also, the whole bruising thing. And this is it, because we don't fully understand things. So when I don't leave bed or move a lot, like, I'll start getting ulcers and stuff like that from, like, not moving. But, like, I won't have a crazy amount of bruises if I don't move. And stay on a very soft surface of memory foam. I'm okay. So if I go to a doctor, having not moved, maybe I'll only have like a bruise. But then if I just start living my life like a normal person, then suddenly I'll have tons of bruises. And then if I don't cut out the things that cause inflammation for me, or I'm exposed to them a lot, then the bruises get even worse. And then if I'm really stressed because of a variety of different things, the bruises get even worse. So we don't really fully understand with EDS where or maybe we do, and I don't know, where the easy bruising comes from. But like for me, depending on what I'm doing, it's like the bruising can get better or worse, but I'm learning to adapt a lifestyle. That stated, I'm like, without access to resources, and a lot of people, depending on how marginalized you are, don't have those accesses to resources. So they're going to end up getting all these symptoms of EDS, or experiences of the syndrome of EDS without, if they have it, with a harder time getting a diagnosis. And yeah, and then it's like if you have access to certain resources that allow you to decrease your symptoms, it can be harder to get the diagnosis.